Today I'm going to be giving a Marvin Hayes his medication at 9 a.m. So first thing I would do is I would check with the MAR. Can't see it, but it's there. And it says that he is to receive enoxaparin sodium 40 milligrams sub-Q, omeprazole 40 milligrams PO, and hydrocodone bitartrate, acetaminophen 10/325 milligrams PO for pain, and we hold that if he has a respiratory rate under 12 respirations a minute. And so, first thing I would do is go to the Pyxis, which is off screen, and I would pull out some enoxaparin sodium. I would then pull out omeprazole 40 milligram tablets, and then I would pull out the hydrocodone bitartrate acetaminophen. And first I would check all these with my MAR. Sorry, I know I'm like off camera. I would check all these with my MAR. So it's enoxaparin, omeprazole, and the hydrocodone bitartrate acetaminophen. Okay, so I would then take the enoxaparin and I would put on gloves, and I would take a alcohol swab and wipe the top of the vial, and I would dispose of that, and then I would take a syringe and I would draw in 40 milligrams of air. And I would plunge the needle, push in the air, lift, and then withdraw 40 milligrams of enoxaparin sodium. I would then one hand scoop the cap back on and make sure it is secure and the needle is not sticking out. I would then take one omeprazole 40 milligram tablet and put it in a medicine cup. I would then take one 10/325 milligram hydrocodone bitartrate acetaminophen capsule, and I would place that in the cup. And then I would put all these back where I got them. And then before I left to go to Mr. Hayes' room, I would check with the MAR for my second check of the medications and make sure that these are all what they're supposed to be and that they're all supposed to go to Mr. Hayes, which they are correct. Okay, so I would then go to Mr. Hayes' room and I would knock, enter, set medications down on a tray or a table, and I would introduce myself while doing hand hygiene. I would say, "Hi, Mr. Hayes, I'm Carson Boyer. I am a TW student nurse, and I'm going to be administering your medication this morning. Could I get your first name and your date of birth?" Okay, and he said his name was Marvin Hayes and that he was born on March 20th, 1977, which checks out with his wristband and it checks out with the MAR. Now, I would now begin I would also ask him if he has any allergies, particularly to the medications that we'll be administering. And he would say that he's allergic to betadine, and that's nowhere here, so we're good. And I would then begin to educate him on his medications. So first I would ask him what he knows about enoxaparin sodium, just in case he has any misinformation that I need to correct. And I would then tell him that enoxaparin is an anticoagulant and that we'll be giving it via sub-Q injection or subcutaneous injection, and that it's used to prevent blood clots mostly, and that it's usually given, anticoagulants are a pretty common thing to give in the hospital just because a lot of people are bedridden and they're not moving around much, so they're not getting a lot of blood flow, so we just don't want any clots to form. And that some common side effects would be bruising, chills, fever, hemorrhage, and that hemorrhage is a particular one that we do not want to see, and that he needs to report any signs or symptoms of excess bleeding or internal bleeding, which is hard for him to deduce himself, but I'm sure he'll know. And that if he just feels like something's wrong, he needs to report that to us so we can make sure he doesn't have a hemorrhage, and that this interacts with aspirin, penicillin, and other anticoagulants. So he needs to let us know if he's taken any other anticoagulants, aspirin, or penicillin, so that we can either wait for those to get out of his system or we can find a better medication for this situation. And then next, I would let him know about omeprazole, which is a proton pump inhibitor. It reduces stomach acid. It's usually treated for used to treat acid reflux. And some side effects would be abdominal pain, headache, nausea, vomiting, fever, and that he needs to let us know if he has any fever or diarrhea, because those are some side effects that we do not want. And that this needs to be taken with meals and swallowed whole. So we can't crush it or cut it up or anything like that. It has to be swallowed whole, and it has to be taken with a meal. So one thing I would do with the omeprazole was make sure that his food tray is either in the room or that I know that it will be here within the next couple of minutes, preferably in the room when I give it. And then next would be hydrocodone bitartrate and acetaminophen, which most people know it as Vicodin, and that's an opioid analgesic, and the acetaminophen part of that would be a non-opiate, salicylate analgesic, and that this is for severe pain, but it's very habit-forming. It's very helpful, but it's very habit-forming. Some common side effects would be lethargy, dysphoria, a feeling of dependence on the drug, constipation, urinary retention, GI spasms, which really none of those are ideal, and that it interacts with other CNS depressants and other oral anticoagulants, which luckily we are giving him another anticoagulant, but it's not oral, it's a sub-Q, so we looked out on that. And we don't have to worry about another oral anticoagulant, but if he's on any other CNS depressants, he needs to let us know. So after that, I would go on to administer the medications. So I would start off with my enoxaparin, so I would do hand hygiene again, and I would put on clean gloves. And I would then expose his abdomen, which it is, and I would take a alcohol swab and I would swab the area that I'm going to be administering the injection to. And so I would dispose of that, and then I would take my syringe of enoxaparin sodium, and I would uncap it. I'm not going to for safety reasons, but I would uncap it, and I would say, okay, first, sorry, I messed up almost. I would do my 6 checks my 6 rights before I administer the medication. So I would make sure I have the right patient, which I would check with the MAR. I would do my final check here before administering. So this is Marvin Hayes. I've checked with his wristband that it is him. And then I would check my medications to make sure I have the right medications. And so I would do my 6 rights, which are right person, right medication, right dose, right route, right time, and right documentation. And my watch shows that it is 9 a.m., so it is time to do these. So this is where I would put on gloves, clean the area with a swab, uncap my syringe, and then I would say, okay, on 3, I'm going to say stick, and then I'll stick you with the syringe. So 1, 2, 3, stick, would inject, then withdraw the needle, and as soon as I withdraw the needle, I would activate the safety device and put it in the sharps container, and then I would get another alcohol swab, and I would apply gentle pressure just to make sure no microbes make their way in. And then I would dispose of that. And then I would hand him the cup with the omeprazole, 40 milligrams, and the Vicodin. And I would give him that. He would put in the ticket. And then I would give him a sip of water to help those go down. And then I would dispose of these cups. And then I would just go through my 5 Ps, which are pain. So I asked him if he had any pain. And I just gave him Vicodin. So if he was experiencing pain, I would just tell him, well, wait it out. The Vicodin, I'll come back in about 30 minutes, and if you're still in pain, then we'll see if there's something else we can't do for you. And then next would be his position. So I would ask if he's in a comfortable position, if he needs to be flipped at all, if he is uncomfortable at all with his position, and he tells me no. And I would ask if he needs to go to the bathroom, and he said he's good. And I would then ask him if he needs any of his personal belongings closer. He says no. He says they're all within reach. And then lastly, I would ask him, or I would check his plugs and pumps to make sure they're all connected and they're not tangled and that they're all properly taken care of, and they are. And so then I would make sure that his call bill is within reach, and I would hand hygiene, and I would leave. Thank you for your time, Mr. Hayes.